Implant dentistry, from consultation to final restoration. Implant dentistry has changed the practice of dentistry, giving patients a lasting replacement for missing teeth. From the initial consultation all the way to final reconstruction to final restoration, receiving dental implants could be life-altering. In this clip, we'll explore the many steps that are involved with the procedure of getting implants, beginning with consultation until your final dental restoration. Consultation. The initial step of the procedure of implant dentistry is a meeting with a dental implant expert. The dentist will examine the health of the patient's mouth and assess if they're suitable for the dental implant. This could include taking X-rays and putting together a treatment program according to the patient's specific demands. Implant placement. If the patient is accepted as a patient for dental implants, then the next thing to do is placing the implants. It involves the surgical installation of the implant within the jawbone. It will ultimately join the bone through the process of the osseointegration. This process is essential to the successful operation of the dental implant since it will provide a secure foundation to support the final restoration. Healing process. When the implant has been implanted after the procedure, the patient must allow for time to heal before a final restoration can be affixed. The process of healing can last up to a few months as implants need to join with bone before it is able to help support the final dental restoration. At this point, it is possible that the patient will be provided with a temporary replacement to fill in the gaps created by a tooth loss. Final restoration. When the implant is fully formed and is bonded with it, the last restoration may be attached to implant. It may require the use of a bridge, crown, or denture, dependent upon the specific needs of the patient. The final crown is custom designed in order to complement the natural teeth to create a perfect and natural-looking smile. Aftercare. When the final dental restoration has been placed, the patient is required to be careful with the dental implants in order to prolong their life. This could include regular checkups with their dentist and cleans in addition to regular dental hygiene routines at your home. When properly maintained, dental implants could last for years and give patients the option of replacing their teeth. Conclusion. Implant dentistry provides patients with the option of a long-lasting and natural option for missing teeth. From the first consultation until the final crown and beyond, the procedure of obtaining dental implants may be life-changing for the majority of patients. Through understanding the many stages of the procedure of getting implants, the patient can make well-informed decisions regarding their oral health and attain the perfect and beautiful smile.